Hello everyone, I'm Dr. Bang Ji-sung, the magician who protects your hair. It's truly a pleasure to meet you all. I will briefly explain the procedure you'll undergo after hair transplantation and then elaborate on the common difficulties patients often encounter during this time. After the transplant, new hair starts to grow in and it's curly. But over the course of 6 to 9 months, it gradually straightens and fills in further. It undergoes a process of straightening and filling, so the hair has now emerged. Once it's grown, it's not exactly a side effect, but the things patients dislike most are when the density looks sparse and when there's asymmetry, making it look uneven. Those are the two main complaints. For some people, the hair really does grow in evenly and beautifully all over. Those patients feel less anxiety. But for others, the hair grows more on one side, or one side just grows in faster. I wish it would grow evenly for everyone. Ideally, it would all grow evenly, but if one side grows faster, a noticeable difference in speed emerges. You see, transplanted hair never grows to its original thickness at first. Therefore, concerning the density, it's essential to request and compare the photos taken during the hair transplantation surgery. This is to check the density that was achieved right after the surgery. Before the 1-year mark, it will never be at 100%. Absolutely not. Patients who reach 100% are truly lucky. They have a good scalp and manage their aftercare well. Most, however, won't reach 100% before 1 year. You might be unhappy if the density looks sparse or if there's a lot of thin hair, but this is something that will resolve over time. You can truly trust the process and wait. Occasionally, there's asymmetry between the right and left sides, and from what I've seen over a long period of observing progress, the right side is usually a bit faster. Strangely, the right side is always faster. This side grows in more quickly, while the left side, particularly the hair parting, is the last to fill in and thicken. Now, if you meet a clinic or consultant who doesn't know this, they can't explain it properly, but if patients get this kind of didactic explanation from the start, they can feel reassured because the process will unfold as I've described. That's why explaining and monitoring progress are so important, because you'll think, this doctor understands the process. Then you'll think, I'm on the right track. That brings peace of mind, doesn't it? But what if the density is truly sparse? It's been a year, and it's still sparse. This is something you can resolve by discussing options like a reoperation with your doctor. And if the thickness is unstable, you should also wait, but if it doesn't improve, you'll need to take supplementary steps. Yes. Today, we've discussed the hair transplantation process and some of the uncomfortable issues or side effects that can arise. I hope this was very helpful. Thank you.